Hello, everyone. Welcome to Kinesthetic Knowledge on Record, your go-to source for in-depth discussions on fascia, anatomy, and your body. Welcome to episode 2 of the series, where we will be understanding pregnancy-related changes with a focus on the knee, the foot, and fascia. I'm Mahnoor, and I'm super excited to be today to be joined by another amazing collaborator, Jayhan.
Hi everyone, my name is Jay, and I'm very excited to be exploring this topic with you.
Thank you so much, Jay, for joining me today. Maybe before we get into a lot of the details for today's episodes and the nitty-gritty detail, we can each share why we're interested in this topic. And so, for me personally, I was really interested because of a lot of the research that I did and how I always came across, like during pregnancy, how there are a number of biomechanical and hormonal changes that occur. And when that happens in the body, it can actually alter a lot of different things like the spinal curvature, your balance, and gait patterns. And as you may know, these are key areas of the human body. And something else that I found was that in turn of these sort of changes that happen, it can actually greatly impact quality of life of individuals because it increases pain and the risks of falls. And so the reason we see so many of these effects is likely because of a number of hormonal and biomechanical changes. And with that in mind, I wanted to see how these changes sort of manifest specifically in fascia and then particularly in the knee. So I'm just wondering, Jay, would you like to share as well what your interest?
Well, first of all, you sound very passionate about this realm and that you've done a lot of work. So I do want to highlight that. And then I'll also share kind of my reasons for being interested in this topic and also for exploring the realm of the knee. So my project for the past semester has been genuinely about how the knee works when you jump. And that's kind of where I started. But by the time I finished the course, it was so much more beyond that. And I started to look at the knee and how it works in the lens of sex and gender. And naturally, one of those areas that I explored was female menstruation. And then beyond that, I realized that there's a lot of hormonal changes that occur during menstruation that affect knee and ligament laxity. And then downstream, of course, when there is pregnancy, the pregnancy can also very detrimentally affect the hormone changes and I guess, the way that the body changes according to a new fetus that it has to accommodate for. So my research kind of naturally went down that portal, and I found myself learning about how the body changes with pregnancy and how MSK is affected in that process.
That is just so cool. And I know I always say this, but I literally love to hear everything that you always have to say, especially like your entire journey about like how you got into the research and sort of like why it is your interest. So I'm just really excited to have this opportunity to feature you on this podcast, and just learn more about your research. So with that in mind, maybe you can start us off with like a little bit more of a deeper dive of your expertise, and then we can kind of head on from there into the specifics.
Yeah, that's a great place for us to start. So maybe the first thing I'll start with is some of the kind of neat implications during pregnancy that a lot of us really don't realize happens. So I found a lot of studies that most of them were kind of systematic reviews that collected this data on a large spectrum across multiple populations. But what they found was that there was a common complaint from pregnant individuals about knee pain. And they found that there was more complaints according to certain factors of different populations. And what they found is that those with high levels of activity, those that are of younger age, those with higher BMI, and those with a history of knee problems in their life are the ones that are more frequent and in saying that they have knee pain and that have exacerbated knee pain during pregnancy. Um, a lot of research also suggests that the knee and the ligaments in the knee experience laxity or kind of stretchiness very much after pregnancy, and that's an implication that they only realize after the birth, and they're able to measure after birth to see a significant change in the kind of the tensile stretch of those ligaments.
Wow. Okay. That's really cool because for some reason, like even when I do my own research and if I come across things, I always think that you would see more during pregnancy. I mean, of course there is implications post-pregnancy, but for some reason in my mind it's always sorry, during pregnancy. So maybe you can share more about why it's more post or at least like in your research that you found.
Yeah, well, there absolutely is like changes during, but I think the reason I was bringing up more of the post is because those are the ones that put the females particularly at risk when they're doing activities later,
Mhm.
like after their pregnancy. So I feel like that's why I explored that. But there are absolutely reasons during pregnancy, and one of them one of the kind of risks during pregnancy is that pregnant women, like if you think about the way they walk, they have very knock knees, which is called valgus knees. And that's when their knees point inwards and their positionality of the knee is permanently altered, and it's more makes to make their body a bit more flexible. And the result is that there's a posterior translation of the tibia relative to the femur. And interestingly, that puts the PCL, or the posterior cruciate ligament, particularly at risk, which was interesting to me because in my research, I learned that the PCL is actually the strongest ligament in the knee and the one that undergoes the least rupture. So that's quite interesting. And also, when the female body kind of goes into a knock knees or a valgus position to accommodate for the big belly of the baby, there's also an increase in the anterior compliance, meaning that the ACL is very much affected and that the tibia is able to translate forward more than it usually does. So those are some changes that definitely happen during pregnancy.
Yeah, no, that definitely makes sense. And then, so I guess I'm just wondering, so all of these changes, they're happening because they are meant to help basically the individual prepare for eventual delivery.
Yeah, absolutely. So I also was kind of confused about like why on earth is there so many hormonal changes in the female body, and like why is it related to the knee? And what I realized that there's actually estrogen receptors on the knee, and I was like, why are there estrogen receptors on the knee? That seems so silly to me. But as I continued to explore, I realized that the estrogen receptors on the knee are actually for the purpose of making sure that the body can remodel itself when the female is preparing to deliver a baby. So those elevated levels of estrogen are also related to another hormone called relaxin, that is basically a hormone that follows the same kind of peaks and ebbs of estrogen, but it has a more collagenylytic, or like breakdown role in the body. So it breaks down the collagen, whereas estrogen can regulate the amounts of collagen being made. So those two hormones, estrogen and relaxin, are very prominent in remodeling the joints to help prepare the female for delivery. There's also, with that in mind, there's also an altered gait throughout pregnancy happening because they're carrying a large load, which, if you think about it, leads to kind of post-pregnancy mechanism change. And there's also the body's habitual mechanism of like you become very, I guess your body adapts to the way you walk when you're pregnant. And
Mm,
then when you lose that weight after pregnancy, your body has to undergo a very habitual shift to kind of relearn what kind of gait is best for the body. So that can also put particular ligaments under stress.
mhm,
I also read a study about females that are particularly active while they're pregnant, and they're in a lot of standing positions. So this includes like a female that's a surgeon that's constantly standing while they're pregnant. And I
mm,
found that there was a lot more tibiofemoral contact when they're pregnant and they're standing a lot or they're very active, which causes the cartilage to rub against each other on the femur and the tibia. And that can lead to very early osteoarthritis, which may translate to a pregnant woman in their doctor's office saying that they have knee pain. And
mm.
also, the osteoarthritis and the bone fragility kind of can lead to downstream impacts on the ligament structure because it makes them, particularly the ligaments, more at risk from being pulled off of those joints, or of those bones, since the ligaments connect the bone to the bone. And that's where a full tear can be highly susceptible. And lastly, there's also stress post-pregnancy of ligament laxity change that remodels the cartilaginous matrix in the knee. And there's increased articular contact stress from that heavy weight load, and that can put females particularly at risk for knee pain, both during and post-pregnancy.
Wow, okay. Lots of great things here, and I learned so much in just like those 5 minutes. So, kind of just to summarize, what I'm getting from here is that you have elevated levels of estrogen and relaxin, but the two hormones have sort of different roles in terms of collagen, and then that can have an impact on remodeling the joints, whether that's preparing for delivery. But then there's also something like post-pregnancy stress, which includes ligament laxity, and then you have increased articular stress from heavy weight loads, which then also puts you at risk of injury, but also there's knee pain regarding that as well.
Yes, that was way better summarized. Very well summarized.
I'm just trying to get the main points across, so that's good. So you did a good job of explaining it, so that's amazing. So kind of very similarly in the research that I've done or kind of looked into during the year was seeing these hormones at play, but when it comes to the plantar fascia, so this would be like within the foot and then when an individual is pregnant as well. So, plantar fascia is basically this vital band of tissue that connects the heel bone to the base of the toes. And so, it is also a type of fascia. And it does a really important role in supporting the foot arch and absorbing shock while you're walking. So, it's giving the foot basically the arch that it needs to have the appropriate amount of like weight being put on it. But what happens during pregnancy is that you often see a lot of sort of structural changes in the foot. And so you'll see things like arch collapsing, overpronation, and swelling. And then this leads to symptoms of heel pain and plantar fasciitis, actually. And then so the research that I did sort of kind of geared me towards understanding that these significant alterations in your like pressures during pregnancy, what they do is that they have an overall tendency to shift the weight on your feet, and then your dominant foot was going to basically bear more weight. And then what this does is that it increases hind foot pressure relative to forefoot pressures, and this leads to this compensatory biomechanical response to the anterior shift of the center of mass because of obviously the abdominal load. And then, of course, you have what I mentioned overpronation. What you have is that overpronation is commonly reported of the foot during pregnancy, and then this then also contributes to the plantar fasciitis and heel pain.
Wow. Okay. So it's definitely very connected with load bearing as well. And I'm just curious, can you tell me a little bit more about how maybe some of the hormones I explained previously are they involved here as well?
Yeah, so actually the hormones are definitely connected. Could have mentioned that earlier, but also I'll talk a little bit more about that now. So, maybe you've heard about this before, but in pregnancy, there's usually a lot of increased water retention, particularly in the ankles, and that sort of leads to having this increased foot width and contact with the floor because of this water retention and basically swelling in your ankles. But then you also actually have higher relaxin levels which then play a role in relaxing your plantar fascia. So because you have higher relaxin levels, your plantar fascia is not as arched, and that leads you to be more flat-footed. And so a weakened plantar fascia combined with increased weight from pregnancy really pushes downward, and there's reduced arch height, and then there's an increase with foot contact with the floor. And this is usually actually in a lot of the research that I did, most of them systematic reviews as well. They saw that there was actually a there was an association between higher reported pain levels and women with these impacted arches with flat feet. And then because of that, they were actually also at risk of injury and pain.
That is so interesting because now I'm thinking back towards what I was speaking about earlier about valgus or knock knees and how there's so much medial pressure on the inside of the knees. I'm wondering if the relaxin making kind of a more flat foot in the plantar fasciitis or the plantar fascia, I wonder if that also contributes to just how knocked the knees are and how much kind of like um, how much of an angle there is on the medial side of the knee. So that's really, really interesting. And there's a lot changing. Um, I might add something here regarding gravity, actually, and gait. And so, something that I learned about also is that pregnant women experience a very anterior shift or a shift forward in their center of gravity when they are carrying the baby. And so their knees, as a result of that kind of forward shift in their gravity, tend to hyperextend. And to maintain the balance in their upright position, the hyperextension is particular on the anterior cruciate ligament or ACL. And of course, it's at the connection to the femoral notch where it's mostly pulled in order to maintain the center of gravity. And the interesting thing is it's pulling more than it can typically stretch. And this is a way for the body to adapt to the pregnancy, but it also kind of puts a lot of tension and strength on the ACL.
Mm.
So after the baby is born and the body center of mass, or sorry, center of gravity returns back, we now have this kind of stretched out ACL with less tension, and the tibia will now naturally tract a bit more forward than it usually did pre-pregnancy. And so for me, this was a question that I was wondering, I worried about like being an athlete after having a first baby and what that might look like for the bones and the body structure, and how that might lead to more ACL injury down the line for those athletes.
Wow. Okay, so that's really cool. So then does this traction forward of the I think it was ACL, Does it
Mhm.
sort of last the whole time post-pregnancy? Like, is that a permanent change that's gonna happen?
That's a really good question. It's honestly quite unexplored, and they haven't measured some of the long-term effects post-pregnancy, but there is a little bit of evidence on it. So, as that center of gravity continuously moves forward in the mother's belly and expands, and the body makes those adaptations to be able to stay upright, and one of them is pulling on the ACL. Um, then after when the mother delivers the baby, um, there while they're after the baby is delivered, while afterwards there might be some collagen remodeling of the ACL because the ACL is made 80% of collagen. There might be some changes in collagen and it might restructure some of it or add strength to it. Ultimately, that ligament is very stretched out. Which leads to, as I said before, if a female is to return to sport post pregnancy, they might have to learn to train their quadricep and their hamstring to be stronger and their thigh muscles to be a lot stronger and also to fire in synchronicity because when they're not fired in synchronicity that puts those ligaments particularly at strain. And so ligament laxity does have a downstream impact, of course, as we talked before, on osteoarthritis. Especially this is more of kind of a downstream piece of evidence that we really do know is that pregnant women experience osteoarthritis in their knee down the line and oftentimes permanently in their life. And this could be a kind of connection here because that ligament laxity could be a possible reason for those bones to have more contact with one another since they're stretched out and unable to maintain that bone structure. So, this, as I said before, is a little bit unexplored, and a lot of this is kind of like speculation in the literature, but there is a little bit of evidence on the downstream impacts. And from what it seems like, there is some permanent change, and the body needs to learn to adapt.
Yeah, that's really interesting. I think like the fact that it's not as explored, but it is very much impacting or does impact a lot of individuals. It's kind of the unfortunate aspect about it. Like that's probably why I first started to look into these things anyways, because I don't think I was like hearing a lot of talk about it or there wasn't a lot of information. So it's great that you were exploring that and that you do have like there are some connections there as well. So that's awesome. I think I can also like add here. I know I mentioned this a little bit earlier about the hind foot and the forefoot, but maybe I can talk about that in a little bit more detail here because there is sort of this notable and disproportionate rise in the static hind foot pressure compared to the forefoot pressure during stages of pregnancy. And I feel like that's kind of related to understanding the sort of permanent change that can happen when you do, um, like when you're maintaining post-pregnancy changes. And then, so when I'm talking about these pressure changes, there's actually a shift in plantar pressure distribution towards the hind foot. And this is actually believed to be a compensatory biomechanical response to the anterior shift in the body center of mass, which is caused again by this increased abdominal load. And then when we also have the overpronation of the foot, it's been, seen a lot in the studies. And then this one study that I specifically looked at, McKeska et al., they actually found statistically significant increases in hind foot pressure. So I've been mentioning hind foot a lot, but like to orient yourself, it's like the part of your foot that's right by your ankle, particularly on the right side. But then there were some studies who suggested that there was more of an increase in your forefoot plantar pressure, which is near the front. And so there was just so much sort of like it could happen in this part of your foot or it can happen in this part of your foot. So some contradictory but very dependent on individuals. So I feel like that's kind of how we can take the information surrounding this topic, that it is very person dependent too, and sort of like how a pregnancy looks for per person.
Yeah, absolutely. And I think that when we start to look into independent cases, we can really unpack those kind of individual factors that contribute to those changes. And one that I really was interested in was age. So, interestingly, there were some studies that reported, as I said earlier, that younger women have more knee pain upon pregnancy. And this was so interesting to me. I was confused about this because um, I just sort of had maybe a misconception or a misunderstanding that the later in your life that you have pregnancy, the more kind of knee pain or pain in general that you complain about in your body. But it actually that was a couple hypotheses that had been made around why younger women have reported more knee pain.
Mhm.
And the first is that Number one, it is likely their first pregnancy, so their body is undergoing the most remodeling and structural change and the laxity of ligaments. Whereas if it's a third baby or a second baby, the body has already gone through musculoskeletal changes and is already ready to kind of adapt to those differences. Whereas if it's the first one, your body's undergoing obviously a lot of change. And if for younger women who are having their first baby, that might be a reason to consider more complaints of knee pain.
Yeah.
As well, they interestingly found that younger women were found to have lower thigh muscle strength, especially women in their mid 20s and in their 30s. I don't really know why that is. Something that I could possibly speculate is diet, potentially depending on cultural context, beauty standards. But that definitely puts more strain on the medial parts of their knee if they don't have strong thigh muscles to antagonize the valgus direction with the varus direction. And thus, those younger women were found to have a very higher degree of valgus needs and reported more knee pain in general. So that's a really interesting kind of wormhole I found myself in during my research.
Wow, that's actually very, very cool, and especially in sort of the like the societal and cultural aspect as well of like why they might be having that lower thigh muscle strength. And then when you were talking about age, actually like reminded me of this like statistic from South Asia regarding um, like adolescent pregnancy and how in South Asia, like reportedly there is the highest prevalence of adolescent pregnancy. And I think it's about 35% of the adolescent population is usually like they get married at a younger age and they might be experiencing pregnancy at a younger age. So maybe you came across this in your research, maybe you didn't, but I'm just kind of wondering what you think, what are some sort of implications of that or anything that you have to share regarding that, maybe?
That is a really interesting point. I don't know if I can say too much on the specific statistic or what the downstream implications are, but I can kind of mention a connection that I found in my research, and that was that a lot of studies spoke about measured ethnic differences in osteoarthritis. And there's a study that mentioned that South Asian populations are the ones that tend to have a higher prevalence of knee osteoarthritis.
Mm.
And while the study wasn't centered on just females, this could your statistic earlier could be one of the contributing factors to why a lot of people in South Asia are reporting knee osteoarthritis and knee pain.
Mhm.
Maybe because they're having kind of early adolescent pregnancies that change their bone structure, change their MSK structure, and therefore are putting them more susceptible to downstream impacts like that knee osteoarthritis. Especially if there is that added cultural norm to birth early or have multiple births in a lifetime.
Yeah, I think I'd have to agree with you on that, especially on the sort of standard around that. So that definitely does make sense. And I think also like when we think about downstream effects, like let's say there are younger pregnancies, and if your plantar fascia is impacted as well at such a young age, it could probably bring like more significant impacts on, let's say, plantar fasciitis and just normal ankle health as well. And then you can also maybe think about other social and cultural factors that could impact individuals. And that could be diet, socioeconomic status, but I think that may be a conversation for another day. I think we've had a lot of food for thought today. So I think that that was amazing. And we've kind of seen how all of our research from the semester was sort of able, some of our research from the semester was able to be connected through a couple of different things in the body, but specifically from a pregnancy context. And then, so before we end, maybe we can reflect on some key takeaways from today's discussion. So, Jay, what do you think would be the most important message for our listeners?
That's a good question. I think I would say that the most important message is just how multifaceted the vulnerability of female knees are and how much of the female musculoskeletal anatomy shifts during pregnancy to accommodate for the baby. And it's a lot more complex than we kind of make it out to seem. So um, I would particularly kind of put out a message for the female athletes that are undergoing bodily changes or that have been pregnant before, to just be very aware and to learn about those changes that affect their body just beyond having the baby. So I guess that's my big takeaway.
Yeah, 100%. I completely agree. Okay, so thank you so much to our listeners for tuning in today to today's episode of Kinesthetic Knowledge on Record. And a special thank you to our guest, Jay. So tune in next time, everybody, and take care.